For the first time I sat down with Vivian, Green Power, APAL, Leslie, Ben, some of the people in the crowd here, back in May of 2018, about a year and a half ago, I knew this project was for mid systems. Vivian told us she had a vision for Benito Health Foundation. A super efficient, resilient, modern, critical care health clinic that could remain open during an emergency to serve her community when the grid power was down. This resilience wasn't to be based on some carbon-heavy diesel generator running on the side. The vision was to have a zero-carbon, solar-powered battery backup system that would allow the clinic to stay open for a whole week. Something we call a microgrid. A system that can operate without the utility grid, powered by on-site solar generation. These renewable-powered microgrids are a relatively new concept. Today, there's only a handful of them operating in the entire world. But her vision didn't stop there. Vivian also wanted to simultaneously complete a modernization of the entire clinic, the reception area, the lab, the treatment rooms, increase the secure access and security, update all of the ADA accessibility, build a fully equipped new training kitchen, conference room, state-of-the-art presentation capabilities. She wanted SPHF to be the envy of healthcare clinics across the state, providing a patient experience and quality of care to rival the most extravagant new facilities across the state. She said the work needed to be done without shutting down for a day. She said it needed to be cost effective and it needed to be completed in 12 months. Some of her peers said it couldn't be done. They told her, there's no ROI on a microgrid. It just can't be done. And Vivian replied, providing emergency critical care and saving lives is all the ROI we need. So, she was told that this whole thing was impossible, it just couldn't be done. And so I replied, well, that's great because MID specializes in the impossible. When someone says it's impossible, that's when we step up, and that's kind of our calling card. The coordination required to be successful was really unprecedented. To our knowledge, there had never been a project like this that ever been done before, incorporating all of these complex elements into a retrofit with an occupied space, let alone an operating critical care clinic where they have vaccines on cold storage that needs to be kept cold or be lost. In order to create a zero-carbon resiliency, we needed to first reduce the facility's energy consumption to a more manageable level. We did this by first installing high-efficiency LED lighting and occupancy controls throughout the facility. The new lighting not only saves the clinic almost 30% of their energy use, but also about 20% of the cost, while providing the clinic with brighter, clearer light, enhancing the patient's and staff's experience. We also overhauled the entire heating and ventilation system, installing all new high-efficiency rooftop units and a wireless mesh control system which continuously optimizes the interior environment for comfort and cost savings. It can be managed remotely through a web interface. This system also reduces the clinic's energy consumption by another 30%. Now that we've reduced the total need of the clinic on a daily basis, we could design a more cost-effective rooftop solar generator that would fuel a lithium-ion battery backup system that's located in the back corner, something you may have already seen. This system is designed to interact with PG&E while also offsetting the clinic's usage with solar generation on the roof and send any of the excess generation to charge the battery. The battery can discharge small amounts of power when the facility's demand is high and the solar can't keep up with it, and when the energy is most expensive, it's offset by the battery. There are 216 high-efficiency solar modules on the roof, which is the equivalent power to require about 20 California homes. The battery's been sized to keep the facility running for a week in the event of an emergency grid failure. Over the course of the year, the clinic will save about $40,000 per year, money which can all be reinvested into services, providers, and new equipment. All said, the microgrid system will avoid the carbon emissions equivalent of burning 3.5 million pounds of coal or driving 8 million miles in your car. This is all it's keeping it from polluting our environment and further exacerbating the impacts of climate change. Successfully implementing a zero-carbon microgrid would, in most cases, be enough. Say, call it a day, hang our hat on something incredible. But there's still work to be done in completing the renovation and modernization. fully realizing Vivian's vision. And so while the energy systems were being completed, our team was busy tearing out the clinic's less functional and dated areas. We completely redesigned the reception area, the treatment rooms, and the labs with all new flooring, more ergonomic casework, better logistics, and service room. We tore out the old dental areas and created a beautiful new open space with a chef's dream kitchen, training kitchen, state-of-the-art, full multimedia, multi-screen presentation facilities. As you can see all around you, we also completely renovated the parking lot with better drainage and updated ADA accessibility. And we also had the landscaping overhauled with drought-tolerant plantings to further reduce the clinic's impact on natural resources. So here we are, a year and a half later, just cut the ribbon on Vivian's impossible vision. I cannot say enough about our team and their efforts working diligently right up to the day of this event. I can say now that I always knew it could be done, but I'm the guy who gets us these unprecedented projects, not the one who actually out here turning the bolts. It was certainly not without challenges and setbacks, and there were many times when I was unable to sleep at night, praying that a dozen different things would have to line up all perfectly the next day. But our crew, led by their fearless leader, Matt Bartlett, right there, kept the train on the rails, and he turned this vision into a tangible reality. I also want to say a massive thank you to Lupe Ortega and her incredible staff for having the patience and the heart to keep this clinic operational throughout the whole process. We all know how difficult it is to stay focused and provide excellent service while your office space is turned upside down. You guys have been amazing to work around. So thank you. I also want to extend the deepest gratitude to the Aromas Progressive Action League and Green Power for first introducing me to Vivian, trusting that MINT could carry forward this mission, protecting our planet from climate change, starting here in our own community. Your work has never been more important, proving to the world that environmental and social justice are intertwined and absolutely worth fighting for. MINT has been blessed with this opportunity and to be called a partner to organizations like yours. And finally, Vivian. We all have an enormous amount of respect for who you are and what you do. Your commitment to your vision and to the best interests of SPHF and the community is inspiring. You should be proud of your staff and this clinic and all that you've accomplished here. It is truly remarkable. The project sets an example for the community, the state, the country, and really the world. You absolutely can have a fully operational healthcare clinic that provides outstanding service in a beautiful, comfortable, healthy space. That provides accessibility to all people, all cultural, socioeconomic backgrounds, that can stay open during a natural disaster, all while not adding to the problems of pollution, waste, and climate change, but rather having a significantly positive impact on our community, our livelihoods, and the planet. Cutting this ribbon proves the naysayers wrong. What is said to be impossible is possible.